Good evening. Welcome to the November issue of Feet Forward with the Illinois Podiatric Medical Association. I'm here with Dr. Ken Jacoby from Elgin. Welcome.
Thank you.
Good to see you again.
It's nice to see you again. We haven't done the show together for a few months.
I know we've been off for October, but we're back and better than ever.
Hopefully.
Coming off the heels of a great election night yesterday.
Well, it was wonderful. It's really very, very exciting to see.
We're all very proud of our President-elect, Barack Obama. We're here to talk about diabetes. November is National Diabetes Awareness Month, and a lot of people are more and more aware of diabetes as a health problem, but we still have a lot of people who don't understand the connection between diabetes and foot-related problems. So we're going to go into that in a great amount of detail today. Before we do, though, we want to make sure that everyone understands that we welcome calls at any time during the show. We will drop what we're talking about to take your calls. We're all about answering your questions and getting good information about foot care. So feel free to call whenever you want. We'll drop everything and talk to you immediately. So let's talk about the statistics. Just tell me how powerful a problem diabetes is for people with foot problems.
Well, first of all, diabetes is becoming an epidemic in this country. About 23 million people out of 300 million people have it, so it's about 8% of the population. About a quarter of those people, 6 million people, do not even know they've got diabetes yet, and that's really a shame. Once we get them diagnosed, they can be helped. The problem is getting them diagnosed. Many times a podiatrist is the doctor that actually diagnoses them. Someone would come to our office, usually with a sore that's not healing, and when you start talking to them a little bit, they start telling you that they've had increased diet or increase in taking their food. They have a lot of thirst. They're urinating a lot, non-healing areas on their feet. They notice that notice a hair loss on their foot, notice that their feet are cold, and they'll come in with a sore. And then all of a sudden you start thinking, and you start putting it all together, and you realize that they probably have diabetes.
Now in your practice, which is a typical sort of podiatry practice, what percentage of the patients that you see would you say are diabetic?
20%, which is, the statistics say that about 8% of people are diabetic in this country, but my practice sees about 20%. It's amazing. And the alarming thing is that 25% of people 60 or older are actually diabetic.
Mm-hmm. And now you have actually diagnosed people in your office with diabetes, and take me through the progression and that conversation and how it works.
Well, they'll come in with a sore, and they say, this hasn't been healing for a while, and it's just draining all the time. I don't understand why the sore is not healing up. And in actuality, what it is an ulcer. And what an ulcer is a hole in the skin, and it comes as a result of pressure from something. Usually they have a corner or callus that breaks the skin down. And then as you take their history, you find out the symptoms of increased thirst, increased urination, increased hunger, and you start putting it all together. Then usually what I'll do is I'll get a fasting blood sugar, see where that sits, and then depending on what that shows, I'll send them to their internist. If they don't have an internist, we find them one.
So you can actually administer the blood test in the office?
Well, usually I'll send them to the hospital or the lab in the building. Then it gives me some good information. Then we send them to the internist, and they'll work them up further. Now, if we wanted to send them to a specialized internist called an endocrinologist who deals specifically with these diseases, then we will send them there. Once they're diagnosed, the internist, the family physician, can take care of them. The endocrinologist can take care of them. What do they do? One thing they do is they teach them about diet, teach them about exercise. If you diet, exercise, count your calories, get your fat down, you can diet yourself potentially out of the diabetes if it's a type 2. If it's a type 1 diabetes, which is what we see in early childhood, then diet, exercise, watching your calories, watching your fat can keep your sugars under control. You can go about and lead a normal life with diabetes, but you just got to take care of yourself. Statistics show that if you take care of yourself, we can decrease the amount of amputations in this country by 45 to 80%. And if you don't take care of yourself, unfortunately, statistics show that 60% of the non-traumatic amputations in this country is due to diabetes. And 3 to 5 years later, there's a 50% chance of having another amputation. And also, once you have a first amputation, the statistics are that you won't live within another 5 years, because associated with diabetes, you've got heart problems,
Right.
circulatory problems, kidney problems, eye problems, dental problems.
Yeah.
It's a horrific disease, and it's an epidemic, and it's growing.
As I understand it, the American Podiatric Medical Association just released some statistics that show that every 30 seconds a foot is lost due to amputation associated with diabetes. Is that correct?
That is absolutely correct, and it's
a very
becoming
powerful statistic.
it's a powerful statistic, and it's getting worse and worse by the day.
So take me through a way people can help prevent amputation, because I assume that an amputation is only going to occur after a long period of time when someone's diabetes goes undiagnosed or untreated.
Yeah, that's correct. What happens? We just don't amputate something due to the diabetes. You amputate something because something has died. And what happens is, when you're diabetic, associated with diabetes is small blood vessel disease. The small blood vessels start closing up, and as a result, the person becomes more susceptible to sores and infections. When that happens, then amputations can follow. The trick is to prevent these things. Things that people should look at. We'll pop it up on the screen.
Got some foot-related warning signs of diabetes for our viewers.
Absolutely. When you start getting a loss of sensation in your foot, redness to an area, temperature change to an area. It's amazing that when someone gets an infection or someone has a pre-infection, the skin will warm up about 3 to 4 degrees. There's some thermometers out there called, they're dermal thermometers, and that actually measures the temperature in the skin. Hair loss is another thing. Cuts and scrapes, we got to make sure that they heal up uneventfully. Things we can do to prevent problems. We really need to inspect our feet daily, especially for diabetic and neuropathic, which means we're losing sensation in their feet.
The hair loss one was not one that I had ever heard before. What's going on in the foot?
Well, the reason we get hair loss is there's decreased circulation to the area, the cutaneous, the skin. Now, the skin is our largest organ in the body. You ask someone, what is the largest organ? People say the heart, the lungs. Actually, the skin. The skin is the largest organ in the body, and you have to take care of it. Also associated with diabetes, they're people's autonomic nervous system, which is a different type of nervous system that everyone doesn't really think about. That causes our skin to dry out, and when our skin starts drying out, we get cracks in the skin. Those are perfect areas for bacteria to infect. So, what do I want people to do? I want them to moisturize their feet when they've got dry skin to prevent cracks. I want them to wear proper fitting shoes, shoes that do not put a lot of pressure on areas. I always tell women, I want you to fit your foot and not your head. Everyone's feet are a little different in size, so make sure that you always fit the shoe to the larger foot. Don't bathe in hot water at all. I always ask people, test the water with your hand. If it's comfortable to your hand, then you can start bathing in it. If you try to test it with your foot and you're neuropathic, which means you don't have normal sensations,